Next, we'll move to Dr. Lisa Abisaus, who will talk a little bit about going to the gynecologist. Nobody likes to go, although we do our level best to make it as benign an experience as possible. Part of being here tonight, we're a local OB/GYN practice. We have an office here in Madison, and we really are trying to be more engaged in the communities that we serve. So this is part of it, and hopefully when you come in for a checkup, you'll feel relaxed and comfortable in the environment. And somebody like Lisa, who's also a mom of 4, is very good at that. And I'll start with the first question. Lisa, what should anybody expect when they come for their first GYN exam?
Okay, so when you come for your first GYN exam, there's actually a lot of talking that goes on. There's a lot of misconceptions. People think it's going to hurt. Everybody's nervous. So if you feel like you're going to be nervous, you're not alone. Everybody's nervous. But we really do a lot of talking. We really want to know about you, your family history, your medical history, your menstrual history. How old were you when you first got your period? Do you have any period problems? Painful periods, heavy periods, irregular periods. So we really want to get to know your history in terms of that. And then, of course, we do a thorough exam. We start by doing blood pressure, just like you're used to at your typical doctor's visits. We listen to your heart and your lungs. We do a full checkup. We obviously focus on the female part, so we do a full breast exam, and we'll teach you how to do the breast exams at home. And then we get to the pelvic exam, which is the part that makes everybody nervous. But we talk you through it. We'll let you know what's going on, and it really doesn't hurt. We use what's called a speculum to visualize your cervix and visualize the walls of the vagina. And it goes in and it does feel like pressure. It shouldn't feel like pain. Mostly feels like pressure, and that's also how we get your pap smear, which is a screening test for cervical cancer. So that feels like a little bit of a poke, but once again, not really painful. And then we'll do the bimanual exam, which allows us to do an internal exam and check your uterus and your ovaries. And then, of course, there's always time to explain what we did, as well as take questions and come up with the plan for whatever counseling is pertaining to you.
So I'm a 19-year-old female college freshman, never been sexually active. Is it time for me to go to a GYN at 19, not sexually active?
Yeah, absolutely. Yeah. 19, whether you're sexually active or not, is really the perfect time to come. Even if you're not sexually active, as I mentioned before, we really want to talk about your history. We're going to talk about cancer prevention. We're going to go over family history in terms of your risk for cancer. We'll talk about, in the future, if you're anticipating becoming sexually active, how to prevent STDs and how to prevent pregnancy and how to keep yourself safe. So that would really be the perfect time to come.
Is there any tips you would give people to prepare before they come?
Basically, you really want to know your family history, so ask your parents, your grandparents. It's important to come in with that information. We're also going to be asking about your menstrual history, so if you have problems with that, whether it's painful, irregular, heavy, those are the things we're going to want to know. There's also some misconceptions about shaving and waxing, and honestly, we don't care. So if you do, that's fine, and if you don't, that's fine. So either way, we are able to do what we do and that doesn't get in our way, so that's fine. And one thing to keep in mind is if you're just there for a regular checkup, try not to be on your period. If you're having bleeding issues, that's different because you can't anticipate what will happen. But if you can predict, then it would be better not to be on your period.
Can you explain, because sometimes there's a nuance only maybe physicians know and patients don't know. What's the difference between a checkup and a problem visit?
So the checkup is really the well-woman checkup, where we go over your risk factors for either STDs, cancer. That's basically the well-woman checkup that we do recommend you come once a year, every year, starting now. And the problem visit really focuses in on if you're having a problem, whether you might be having vaginal discharge that smells bad or is itching, then we'll definitely focus in on that and figure out what's going on and come up with a plan for treatment. Or if you're having problems with your period, that becomes a problem visit because we want to get to the bottom of it and come up with a plan for treatment with that as well.
There's sometimes people have to come in and explain what's going on with them. Can you give some tips to the audience about how to be kind of a good medical historian as a patient?
Mm-hmm. So it's really important, number one, just to be honest with your physician. keep in mind that everything you tell us is confidential, and we wouldn't relay that information to anybody else without your permission. So it really helps us to get to know you and to be able to come up with a plan if we have all the honest truth that goes behind it. So that really is the most important thing, that don't leave anything out. Let's say some people come in with the parent, which is great. We want to get your parents' perspective and allow your parents to talk, but we always give you time for the parent to step out of the room so that we can just have the personal one-on-one, and everything is confidential.
Thank you, Dr. Abbas. The question is, are there any negative side effects to getting a pap smear?
So I would say, besides what Dr. Abishow said, that it could feel like pressure and uncomfortable, I would say there's no side effects I can think of. The reason I said we start pap smears at 21, it's thought that if you get a pap smear earlier than that, sometimes if it's abnormal because HPV is so common, you might have to do some other tests, and that can be invasive. So that's the only other side effect I can think about, but not any else otherwise, besides a little uncomfortable. Not a side effect I can think of. I don't know if anyone else can
No,
think of something.
but I think it's important to point out here, because I think medical history helps us remember how far we've come. George Papanicolaou in the 1920s invented the pap smear, which is basically scraping some cells off the cervix, looking at the patterns, and you can see precancerous growth. The most important cancer screening test ever in the history of medicine. So I think 100 years down the road, George Papanicolaou is still affecting women's health. Although going forward, I believe HPV testing will be the new pap smear of the future.
Is there something that you've heard that you're concerned about? Yeah, why don't you tell us that? No, it's not even really skin, it's almost
Mucus membranes,
mucus
yeah.
membranes.
Like the inside of your mouth.
It's almost like when
Yeah.
your lips are chapped or something, and, but in this case, you don't have to put any lip balm or anything. It's just gonna naturally go back. You won't even know it, So no, not at all, if that was your concern.